Good afternoon, everyone. My name is Patrick Tang, and it's my pleasure to welcome you to today's presentation, Centering Race and Health Equity Research and Leadership. This webinar is brought to you by the UNC and University of Michigan Peer Support Corps of the Michigan Center for Diabetes Translational Research. The Peer Support Corps is designed to foster rigorous translational research in peer support in diabetes prevention and management. If you are a researcher interested in peer support and diabetes translational research, we invite you to join our network. You can do so by sending us an email at peersupport@unc.edu. I'll drop that in the chat, or you can visit us on our website to learn more about what we do. So before we get started, just a couple of quick housekeeping items. Today's webinar will be recorded and will be posted on our website after a couple of weeks. And if you join our mailing list, you'll receive a notification when the video is available for viewing. And we will save our time for discussion at the end. So, if you have questions, feel free to put those in the chat, and we'll keep an account of those, and we'll ask those questions at the discussion at the end. So with that out of the way, I'll hand it over to Professor Ed Fisher, Global Director of Peers for Progress, who will introduce today's speaker.
Thanks, Pat. It's a pleasure to see you all, even in little bite-sized pictures, and to have the opportunity to hear from Daphne Watkins today on what promises to be a remarkably stimulating and interesting presentation, really integrating both research leadership and concerns that we all have acutely these days about how to address racism and injustice in our research and in our research teams. Daphne is the University Diversity and Social Transformation Professor and Professor of Social Work at the University of Michigan. She also heads there the Vivian and James L. Curtis Center for Health Equity Research and Training. Her research interests and studies have included behavioral interventions for historically marginalized groups, mixed methods approaches to research and context, and leadership development in organizational structures. If that sounds broad in its perspective, it matches Dr. Watkins' background. She did her undergraduate degree in anthropology with a French minor at University of North Carolina at Wilmington, and then completed her PhD in health education at Texas A&M University, where her dissertation began her work on mental health of young Black men, which has been a continuing theme of her work. She did a postdoctoral fellowship at Michigan with James Jackson and others in the Institute for Social Research on psychosocial factors in mental health and illness, and then had a K Award at the beginning of her career, in which she also focused on interdisciplinary research careers in women's health. So both African-American men and women's health research careers. With this broad background, she's a community practitioner interested in tools and systems that activate positive, strength-based approaches to human potential and elevate social experiences and provide equitable impacts in communities and organizations. As noted, she's the director of the Curtis Center for Health Equity Research at Michigan. She's also the founding director of the Gender and Health Research Lab, the certificate program in mixed methods research. So if any of you have questions about qualitative research, you can save them. And the award-winning her project, the award-winning Young Black Men, Masculinities and Mental Health, which leverages technology to provide mental health education and social support for young Black men. Reflecting these broad commitments, she teaches graduate level courses on research methods, social equity and equality, and community-based interventions. And she also serves on committees and advisory boards aimed at improving men's health equity, both domestically and globally. When we first talked about this topic, Dr. Watkins said, well, maybe talking about research leadership is for early career people. And I said, you're never too late to learn good lessons from wise people about how to be a better research leader. So I won that argument very thankfully. And the fruits of it are in this wonderful talk that we're about to hear on centering race and health equity research and leadership. Dr. Watkins, the floor is yours, or the Zoom is yours.
Thank you so much, Dr. Fisher. I have to be honest, I am nearing my 20th year in the academy, and I'm still not used to hearing about myself, hearing someone do the introduction about all the things that I've done. But thank you so much.
Get used to it.
You make me sound a lot cooler than I really am, to be honest. And so I'm going to take it. I'm going to take it. But it's such a pleasure to be here today with you all. I'm really excited about talking about this topic that is very important to me, and I imagine is very important to you too, which is why you are here today. So what I want to do now is go ahead and share my screen, and we can get the ball rolling. Okay, so Pat, can I just get a thumbs up from you if you can see my slides? And they're okay, fantastic. So let's go ahead and get started. So it's such a pleasure to be here. Like I mentioned earlier, I'm really excited about talking about what does it look like to center race in health equity research and leadership. And so we're going to just cover, for about 30 minutes or so, we're going to cover just some topics that I think will be helpful to you in your health equity research and leadership. And then we should have plenty of time for questions at the end. Okay, so here is what I am planning for today. So we are going to begin with just setting the stage with some objectives. I want to give you a sense for what I think you should take away from today's presentation. And then in the spirit of just context setting and tone setting, I'd like to give you some definitions. And sometimes, or maybe some people may think, why in the world would you define terms for us, Daphne? But I think sometimes with this work in particular and doing work around diversity, equity, and inclusion, we all assume that we're on the same page around different topics and different terms. And so I don't want to make any assumptions. Instead, I'm going to provide for you some definitions for some terms so that we can all, if not be on the same page, at least be in the same book around some of these terms. I'm going to then cover what I think is a big problem with some of the health equity work that we're trying to do in our profession, and also some solutions. I'm going to then cover some challenges and best practices, and then we're going to begin to wrap up with implications. And like any good lunchtime talk, I'm going to provide you with about 10 takeaways that I hope can be useful to you in your work. So with that, let's get started. So here is the plan for today. If I do my job and do my job well, the goal is to first acknowledge the problem that many health equity researchers and leaders struggle with. And that is this idea of how do you center race in health equity research and leadership? Then we will flat out just name some challenges that are associated with centering race in health equity research and leadership. I'm going to then provide some best practices that are really from the literature. So think evidence-based best practices for ways that we can center race in health equity research for both researchers and leaders. And then at the end, we will wrap up with some recommendations for ways that you can go forward and center race in your health equity work. So as promised, I want to start out with some definitions. So I provide these definitions first and foremost, again, because I want to level set and I want us to have an opportunity to really think through what our own personal definitions are for these terms, but then also how we may be applying some of our own definitions and, dare I say, biases in the work that we do around health equity. So first is a term that I think has become really popular, I would say, over maybe the past 12 to 14 months. It's this idea of anti-racism, which is a form of thought or practice that seeks to confront or eradicate racism. The reason why I start here is not only is anti-racism at the beginning of the alphabet because it starts with an A, but also there have been books like the one written behind me that really talks about how you can go forward and be anti-racist in your efforts. And so really would encourage you to pick up some resources if you're unfamiliar with the term or still have a little bit of learning to do about what does anti-racism look like and how does it play out with regard to our research, whether you're in a university setting or a community setting. And then there's the more popular terms, diversity, equity, and inclusion, right? D, E, and I. So diversity is essentially any kind of variation in an an institution or a group. It can refer to several different aspects of someone's life. One of the things that I've noticed in this business is that oftentimes when you mention the word diversity, I think people's knee-jerk reaction is to think about race. But naturally, and perhaps I'm sort of preaching to the choir here, but naturally there are several different layers to diversity beyond race. Things like cognitive skills, physical abilities, personal traits, SES, age, and so on and so forth. And so expanding our minds beyond race is very, very important when you're thinking about how to frame diversity in your work. Equity is a commitment to protecting all persons from biases, harassment, and discrimination, regardless of race, color, national origin, everything on this list. And I center equity here because for a very long time, the buzz term was equality. People talked a lot about equality, but I'm going to talk a little bit later in the presentation today about the differences between equality and equity. They're very different, although related. And then there's inclusion, which is really about, inclusion is really achieved through deliberate efforts to make sure that an institution or a group setting is a place where differences are welcomed, where there are different points of view that can be considered, and even where each person feels a sense of safety and belonging. So it's about creating spaces and allowing for freedom that will enable individuals to really participate in the decision-making process and develop opportunities to really fully grow and thrive. It's much more than just having people there. It's hearing their voices and incorporating their voices in the work that we do. Then there's health equity, which according to the CDC is when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. So when I think about health equity, I default to thinking about health inequities, and they're typically reflected in differences with regard to length of life, with quality of life, even things like rates of disease, disability, and death, also severity of disease and access to treatment. And so here is just sort of the first page of these definitions that I'd like to present, just for us to be thinking about these terms in context. So next is race, right? We're talking today about centering race in our health equity work. So naturally, we should define race for ourselves. This is probably no new news to the folks on the line here, but race is a social construct. It is socially constructed. It's a classification system used to maintain power and privilege. And then if we look closer at racial equity, it's essentially the absence of disparities in the opportunities and outcomes experienced by differential racial groups when accessing the same resources. So think about different groups accessing the same resources. And by the same resources, I mean things like health care, housing, education, any kind of financial resources, even things like employment. Now, when I think about racial equity, I think about it in terms of it being a framework and a goal. And when I think about it as a framework, I think about it as having concepts that I actually apply to my own work. And I see it as a measurable construct overall. So when you think about it as a framework, it focuses on improving and sustaining institutional systems, practices, and policies so that individuals across different racial groups can flourish and reach their full potential. When you think about racial equity as a goal, it's about focusing on achieving social justice and the fair inclusion of all races in societal opportunities so they can participate and prosper. So this is a great opportunity for us to put on our social work hats, our activist hats, and think about in what ways am I applying racial equity principles and thinking about equity in all the decisions I make in my health equity research and leadership. Racial healing is a term that I don't often see outside of the social work space, but I put it here because of some recent work that I've done with the Kellogg Foundation around advancing racial equity among professional health and human service networks. So racial healing is a process that restores individuals and communities to wholeness, repairs the damages caused by racism, and transforms societal structures into ones that affirm the inherent value of all people. So for a second, do this with me. Imagine a world where our health equity research and leadership actually results in racial healing. It actually does something to not only the communities that we are set out to serve, but also our research teams, the colleagues that we work with, the postdocs, the students, the staff. So there are intentional decisions that we can make on a daily basis in our health equity research and leadership that can actually move us closer to this kind of work and improve the health conditions of the communities that we care the most about. So this is my last slide on definitions. And I just want to highlight these last few before we dig a little deeper into what the problem is with regard to centering race in health equity research and leadership. So racism is a belief that race is the primary determinant of human traits and capabilities, and that racial differences produce an inherent superiority of one group compared to another. Another layer of racism is this idea of structural racism, which is really embedded in the systems. It's embedded in the institutions and the policies, as well as the history and sociocultural norms that reinforce and normalize racism and white supremacy in the United States. Now, what our goals are in this health equity work is really to think about how can we transform systems, right? How can we change the power relationships and structures that affect our lives? How can we do a better job in centering race in our day-to-day work with our teams, with our communities that we care the most about, and really thinking about making a difference for right now, but also in the future? And the last term that I want to define for you is a term that, frankly, I went back and forth about including it or taking it out, and I decided to include it. Because if we are really about promoting health equity, and if we're really about centering race in our health equity research and training, and also our leadership, we have to do a better job of naming the problems, right? Saying things like racism and saying things like tokenism, right? This word tokenism is the practice of recruiting a few people from underrepresented populations to create the appearance of diversity, but without taking action to create more equitable or inclusive practices. So tokenism can also happen by not listening or responding to people's needs and opinions and failing to include them in decision-making processes. So what does tokenism look like? So for the research leaders on the line, it could look like having people on our websites, but not truly understanding what their needs are and not truly making decisions in our health equity research, whether it's actually conducting the research, writing the grants for the research, or providing support for our teams that really address those specific needs, right? It has to be more than having people on the website. It has to be more than saying we're doing health equity work and just including a person of color in the project, but not really listening to their contributions, not really valuing the cultural context that they're bringing to the work. It has to be so much more than that. Right? So if we're talking about health equity and we're talking about centering race, we really have to acknowledge our colleagues who are out here and they're engaging in the kind of work that is not really promoting this effort, right? So tokenism is a real thing and it has a name. And so I just want to mention that as we're going through these next few slides. So what I want us to think about now is in what ways do all the terms that I've just presented to you, how do they influence our health equity research and our leadership? Okay, so thinking about things like anti-racism, diversity, everything that we just covered, The whole purpose for this slide is just to get you to think deeply about the reciprocity that occurs here. These are real concepts. They are happening every day, not only with our communities that we work with, but also with our research teams, right? Sometimes we think that being a health equity leader is about, being community anchored and assembling teams to go out and do the work in the community. And sometimes we neglect to think about the importance of doing the work right there within our teams. So don't miss out on opportunities to fully engage with your team members, your trainees even, around these terms that can really complicate the work that we do want to end up doing in our community. So that's really the purpose of this slide, is just to think about that reciprocity and that exchange between what these terms look like, right? How we're calling these terms out and how that can, in the end, affect our health equity research and training efforts. So now let's frame the problem. Okay, we've spent a few slides setting the tone, getting context, getting on the same page about terminology. Now let's talk about the problem. So I would argue that in the past, maybe 2 or 3 years, this term equity has been a pretty popular term. I'm noticing that in all forms, it's becoming very mainstream. But what I'm also noticing is that researchers with no previous experience in equity are now required to discuss race and equity in their own research and to really talk about it in context. Now, this is a great thing. I think we've evolved in a great way. However, I'm noticing that there are some disconnects in what we're expecting people to do and what they're actually able to do. For example, a lot of the researchers that I'm training, a lot of the ones that I'm collaborating with right now, lack clear standards and guidelines and accountability for health research that centers race. They also lack a clear understanding for how to conduct research that is equitable, but also how to lead teams in ways that center race and equity. And for the work that has been done, some of it is really thorough and it should absolutely be commended. I'm seeing other work that may come across as potentially elitist or exploitative, tokenized, or even opportunistic. And so what I'm hoping we can talk about in just a few minutes, it's really, what does it look like to foster more equitable models of health research that center race and racial equity? So this image that I have here on the screen to the left side of the screen is an image that I created for a commissioned report that I did for the Kellogg Foundation that focused on centering racial equity among professional health and human service organizations in the United States. One of the things that came out of that report is we learned that when we approached organizations, and I'm talking, many graduate level, PhD level professionals, and we talk about racial equity and we ask them specific questions about in what ways are you adopting racial equity principles in your work? Are you applying this to your work? 9 times out of 10, the answers that we received were about diversity, equity, and inclusion, not about racial equity. And so one of the findings from our report was that when you begin to engage with professionals, some top-notch researchers and leaders in health equity research, when you begin to engage with them around issues like racial equity and health equity, they're not fully there yet. They're almost sort of not ready, haven't really gotten to the place where they can confidently say that they are doing racial equity work, that they're applying concepts to their profession or to their field. However, they can perfectly articulate diversity, equity, and inclusion. So if you think about this as a journey, I'm finding that given the big push around strategic plans across universities and research centers around DE&I principles, I think we're getting there. I think we're in good shape. We still have some work to do, however, around racial equity and around health equity and how we're operationalizing those terms in our work. So that is the problem. Now here is a solution, or a series of ways to think about solutions. So I want to give just a quick shout out to the Green Lining Institute's Making Racial Equity Real in Research report. I was able to look at that report and do some work to prepare for today's talk, and I simply adapted some of their concepts for this slide. So when we think about centering race in health equity research and leadership, I see it as a cyclical process. I see that we have to first understand the context of racism in research in the past and in the present. We cannot continue to do this work without really acknowledging the history and America's fabric around oppression and racism and slavery of the past. So first understanding that and acknowledging it and figuring out how you want to navigate those spaces with community partners and also members of our research teams are key. Next, you want to review the challenges, best practices, and opportunities for centering race and racial equity in research and leadership. So do your homework, essentially. Do the studying, do the reading of the books about anti-racism, and talk with colleagues. Be able to have those transparent conversations about what you understand about racism and anti-racism and how to center race in your health equity work, but also what you don't understand and where are some areas you could actually use some improvement. Okay, next is conducting an internal equity assessment of your research and leadership style. And actually at the end of this presentation, I'll provide a resource where you can go and find actually on paper some questions that you can ask if you want to do an internal equity assessment of your research and leadership style. Now, whether it's a formal assessment or an informal assessment, I think constantly having opportunities to really think through what decisions are you making on a daily basis, on a weekly basis, on a quarterly basis that's going to truly promote health equity and also racial equity in your research, right? I think that's important, very important. I'll just speak personally. I constantly just evaluate my team. I take a look at our structure. I see, based on the communities that we're hoping to serve, how can I model my team in a way that actually helps us achieve our goals? So it's constantly assessing and then reassessing what decisions are you making about how people are represented on your team to then actually do the work in a way that is most compelling and most effective with those communities that we care about. Next is partnering with and incentivizing colleagues, students, partners, and research participants. I probably do not need to tell this audience about how so many communities of color have been taken advantage of over the years, right? We know that there are ways that communities of color have been exploited and they have just frankly been abused, if you will. I would even go a step further and say that there are some universities who don't have great reputations in their communities because of this sort of helicopter researcher concept, right? Just researchers coming in, dropping in, doing work, and then leaving. And so just think about what kind of budgetary decisions can you make? What kind of staffing decisions can you make to make sure that you elevate the voices of people on your teams, right? If you're working within communities of color and within topics that address communities of color, thinking about how to recruit and retain and also provide resources to support those people is just super important in this work. And then co-creating the research questions and scope of work with colleagues, students, partners, and research participants. Okay, so this is really a cyclical process. It involves constantly assessing and reassessing, but reminding yourself that you're still a student at this. You know, none of us are experts. And one of my platform statements is that you can't always assume that people of color are experts around diversity, equity, and inclusion and racial equity. I think we have experiences, we all bring something to this conversation, and we're all hoping to learn and grow in our health equity research and training. So now I want to just spend a few minutes covering some challenges and some best practices, okay? And I imagine that there are quite a few challenges that we could cover, but in the interest of time, I'm just going to cover 4, and then we're going to start to wrap this up, and I can't wait to open it up for a larger discussion. So the first challenge out of the 4 that I'm going to cover is whenever you're trying to center race and health equity research and leadership, there is this challenge of the lack of trust and meaningful relationships. Okay, so relationships are important in the work that we do. Relationships with our teams, relationships with our institutions, even relationships with the communities that we hope to work with. Some best practices in order to actually do this work efficiently and effectively is the first is before meetings, do research to understand history, local context, and priorities for everyone. So sometimes as health equity researchers working within communities, we often do the research in the background on the communities that we hope to work with, but we don't do a good job of actually looking within and looking at our team members and doing the research to understand their history, their local context, and their priorities. So include your team in that discovery stage that you're trying to do to really center race in your health equity research. In the spirit of that, also recognizing past traumas and historical injustices, and inquire how you and your work can contribute to reconciliation. Okay, no one is asking you to solve all the problems, but I think it is worth your time, worth your effort and your resources to inquire about what has been done and seeing if there's anything in your work that can help to improve the situation. Okay, and then remember, as you're having these conversations, as you're building trust and meaningful relationships, noting that different individuals may hold different views. So you cannot enter into spaces with your team or your community partners or the communities you hope to serve, assuming things, right? One of the big assumptions that really got dispelled when, when I first started this work was thinking that when I walked into a Black community, because I was Black, they were going to automatically welcome me. And that could not have been further from the truth, right? I think in my youthfulness and in my inexperience, I didn't take into consideration coming from a university, having that, you know, and people seeing that first as potentially a disadvantage entering into communities. But I think, you know, hands down, you just cannot make assumptions based on ideas that you have or even previous experiences that you've had with people. So the second challenge that I'd like to cover is lack of support from institutions or fields to pursue diversity, equity, and inclusion in health equity research. So what are some best practices when you're dealing with a lack of support at your current institution? Well, first, to the degree to which you are able, try to advocate from within, okay? So challenge your institutions to do better. I understand that there are several different institutions that are represented on the line today. Some of us have the capacity to do that, others don't. That's why number 2 is on the list. Build trusting relationships with senior colleagues who can advocate on your behalf and on behalf of your cause. Okay, this is a great opportunity to build some alliances, to work with people who are a little bit further along in their careers than you are and say, how can I approach this challenge? Can you advocate for me? Can you sponsor me, right? There's mentorship and there's sponsorship in these kind of relationships. So what can people do to support the cause and speak on your behalf if you feel a little bit uncomfortable trying to advocate for these efforts or for these ideas in your institution? And then naturally, whether you're able to be successful with that internal advocacy or not, number 3 is so important. So connecting with researchers and leaders outside of your department and your institution around these very important racial equity and health equity concepts, right? Collaborations are key. And thankfully with Zoom these days, we can connect with people outside of our institution a lot easier than we could, say, a few years ago. The third challenge that I'd like to discuss is this idea of a lack of communication and transparency. So what do you do when you're faced with that as you're trying to center race in your health equity research and leadership? Well, first of all, if you're having challenges with lack of communication and transparency, be transparent, okay, about your needs, your timelines, your resources, and your parameters, and be transparent with everyone, okay? One of the things that I've noticed just in my studies as I was preparing for this talk and even doing some work at my own research center is oftentimes we talk about building relationships and doing a better job communicating with our communities that we hope to study and in which we hope to intervene. But there's not a strong literature around being transparent with our team members, right? And really modeling the behavior that we hope we can see in our health equity research. Okay, we can do things like translate and share data and results in meaningful ways, even before you agree to collaborate with individuals on your team, but also outside of your team, discussing realistic expectations. Things like, this is what I hope to get out of this experience. What do you hope to get? This is what I bring to the table. What do you bring? Okay, if you are truly centering race in your health equity research, you are having transparent conversations, which also means you're admitting the areas in which you are weak, right? And you're welcoming people to also do the same in these spaces. And then finally, just during those partnerships, creating expectations for engagement and discussing the plan for communication and how to deal with potential conflict, because it may arise and you should be ready for it when it appears. Okay, and this is the last challenge that I'm going to discuss this afternoon. This last challenge is really about, how do you deal with inequitable power dynamics among research partners? I have a few ideas for best practices for how to deal with this. The first is understanding everyone's needs and co-creating the plan and research questions. Again, that's involving everyone. You want to value diversity among partners with incentives, resources, and support. You want to partner with your team members, obviously, but also the communities you hope to work with to co-design inclusive engagement processes, healthy budgets, okay, and realistic timelines. Also thinking about co-creating equity indicators that reflect the needs, and thinking about, if you're truly centering race in your health equity work, in what ways can you use more inclusive research methods and leadership strategies? Okay, so this may stretch us a little bit beyond how we were trained, but I always encourage my quantitatively oriented researchers to think about using qualitative data, right? To think about using a CBPR, for example. And in the leadership side, managing up, storytelling, using feedback loops to really try to break down those barriers around power dynamics among your research partners. Okay, so I'm gonna start to wrap up here. And let me begin the wrap up with just briefly covering some implications, and then we'll do the 10 takeaways and we'll open it up for discussion. So with regard to what I've covered so far, as we think about centering race in health equity research and leadership, particularly on the health equity researcher side, which I'm sure there are quite a few of you on the line here, if you really focus on racial equity and centering race in your health equity research, you have opportunities for equitable research that you can disseminate, that you can share with others. You have opportunities to contribute to the dearth of literature that centers race in health equity, so growing that science and that body of work. You have opportunities to do, brace yourself, real diversity, equity, and inclusion changes. So like you can do the real work and make real changes and impact. And then you have an opportunity to do research for the people that will matter to the people. Okay, so it's all about elevating those voices. On the leadership side, if you're in a position where you're leading a research lab, a research team, a center, or even an institute, thinking about centering race will allow you as a research leader to build more equitable teams for impact. You can create more equitable models that can be applied across other teams and other units. You can make clear improvements to your institution, being able to advocate and even model the behavior that you hope to see across other units at your institution. And then very importantly, you can think about the next generation of health equity research scholars, right? Thinking about the tone setting and what are you doing now to invest in this next generation is so important, particularly when we're talking about centering race in our health equity research. Okay, so I have my eye on the clock. I am going to go through these 10 takeaways quickly, and then we will open it up for discussion. So first, learn and accept America's racist past. So if you take nothing else from this workshop today or from this webinar, these are the 10 things I want you to take away. Because centuries of slavery and oppression for people of color is part of the fabric of American history. So you have to learn and accept America's racist past. Until the forces that undergird American history and culture are understood and accepted, I think our ability to center race in our health equity work will be limited, okay? Number two, understand how differences have shaped racism. I believe it behooves health equity researchers and leaders to recognize that there must be intentional efforts towards improving the conditions for people of color. Uh, while differences across race, ethnicity, age, etc., are what grows and advances our fields of study and practices, I do think these factors may also be what breaks down our efforts to center race in our health equity research and leadership. Now is the time to admit that implicit bias is to be expected. It's a real thing. I think we all hold some types of biases in our work, but it's also our responsibility as thought leaders and equity researchers to challenge these beliefs whenever we see barriers in our efforts to promote and advance health equity, right? So just amplifying our own voice in this spirit is going to be important as well. Number 3, define and call out racism. Okay, so for America's history, we know that race is the social classification of people based on how they look. Racism is about creating opportunities and also assigning value based on someone's race. It leads to unfair disadvantages for some individuals and unfair advantages for others. Defining and calling out racism, it really helps us to recognize the distribution between race and racism in our professions. And it also allows for opportunities to combat racism and promote racial equity. Number 4, serve the underserved. So remember that equality is not the same as equity. Equality means we should provide the same resources and supports to all people, but equity means the resources we provide will look different compared to the resources the resources that we provide to one group of people or to one person may look different compared to the resources that we provide someone else. So it's not giving everyone the same thing. That's equality. But equity is about giving people what they need to thrive, what they need to succeed. The aim of equity is really to support the needs of everyone so that everyone can thrive. So number 5 on our list is support capacity building with a racial equity lens. Just thinking about identifying and implementing evidence-based strategies and practices that build capacity for and eliminate barriers to racial equity. And getting to the end of this list, these last 5 takeaways are things like supporting bold and courageous health equity research, thinking about race, ethnicity, gender, any kind of specific efforts that you can put at the forefront of your work is very important. You can do this, you will do this, I'm confident of that. Number 7 is to weave race and racial equity through your health equity research. Just weave it all the way through. What does that look like? It means you cultivate an organizational culture in which racial equity is embodied within all programming. Think about staffing, also any kind of activities that you have to support the core values of health equity. You want to do your best if you are overseeing a research team or even a research project to align your health equity mission, your objectives, and your initiative with a moral responsibility to ensure racial equity. Number 8, empower and collaborate. So it is your responsibility to empower members and cultivate partnerships within and across organizations to have a network that is consistent with a culture of centering race in your health equity work. Empower your teams through critical self-consciousness, recognize differences that may potentially divide them, and use those to empower. Number 9, train across all levels. So think about not only accomplishing your own goals, doing what you need to do among your team members, but also what can you give back? You know, how can you sort of foreshadow what is to come by really embedding your principles around centering race in your current team members and thinking about what they can do in the future. And then finally, number 10, support more people across diverse groups. So resources should be allocated to support diverse groups. This is truly how we will advance our work and really, truly center race in our health equity research and leadership. Now, I did those 10 takeaways in lightning speed, so I apologize for how quickly that went, but I do want to go ahead and start wrapping up because we're running short on time and I would like to hear your voices. So in the spirit of resources, I wanted to just share with you some things that I found very helpful in my efforts to center race in my health equity research and leadership. Number one is the Making Racial Equity Real in Research report. It recently came out actually last fall. Found this report incredibly helpful. The second on this list, and I'm going left to right, is the report that was commissioned by the Kellogg Foundation to me and my team. We focused on centering racial equity in professional health and human service networks. That third resource there is a really great resource for just outlining explicit strategies for workforce equity in healthcare and IT that are focused on race. And then one last major report that came out of the National Center for Institutional Diversity here at the University of Michigan that is a great social justice model and framework for thinking about how to do this kind of equity work and do it in a leadership capacity. And then at the very bottom of the slide is a great article in the New England Journal of Medicine that talks about how to dismantle structural racism, and it also provides some practical solutions to doing so. Okay. This is my last slide. Feel free to email me with questions, comments, anything like that. Also, feel free to follow me on Twitter. Twitter is my social media of choice. Big shout out to all the supporters of the work that I do, as well as my Center for Health Equity Research and Training. And with that, I think we can stop sharing and would love to take some questions and have a discussion for the last few minutes. Okay. Whew. I went quickly on those last few slides. So I believe I've stopped sharing. I think I did. Hopefully, Pat, you cannot still see the slides, right, Pat?
You're muted.
Yep, it's back to your video. And
Okay.
I encourage all the audience members to unmute yourselves, turn on your videos if you'd like. If you have any questions, go ahead and type them into the chat. But thank you, Daphne. One thought that came up for us, for me, as you were talking, I'm thinking about what we can do in our research team, what more we can do, and I think this is a question that I'll pose, maybe for some other folks in the audience. We're fortunate in our research team that we can speak very openly about issues of racism and equity. We often give time and space to talk about those issues, even if it's not directly related to our research. What might you recommend to somebody who's a part of a research team as maybe they're just a group member or a research assistant, maybe they're not a leader, a senior leader in that group. How could they promote that sort of environment in a research team where maybe they don't have as much say about how it goes?
Sure. Well, I definitely think they should also talk to the leader about this as well, right? Like, I think it's important to make sure that these kinds of conversations are supported from the top down, if you will. I think, one of the things that I have not had a chance to really lean into in 2021 and 2020 is this cancel culture that we have, right? Which means when someone makes a mistake, we automatically cancel that person, right? We don't see it as a mistake. We don't see it as something that was possibly an accident. And so I think if we approach a lot of this work with this idea that we have to do a better job of recognizing people's mistakes, especially if they apologize, if they really feel terrible about the mistake, and really do more to educate one another around these issues. These issues are not easy to talk about. And when you think about it, for decades, we didn't talk about them, not in health equity research. And so I think we have to slowly begin to build better cultures where we don't cancel people for making a snafu, for making a mistake, for misappropriating a term or a feeling or a thought or an idea. And so I think there just has to be a better job from the top down, but also to your point, Pat, from the bottom up, right? When you think about the hierarchy in these institutions, about what are we doing to better educate people, to better support them so they don't make those same mistakes in the future. And so I think some of us have to learn from our students. We have to learn from our interns and our work study about the best approaches to this. And if you're a leader, you have to be open to learning from those people. If you're a student, being open to helping to set the tone for your research group can be helpful as well.
Yeah, I completely agree. I think we learn so much from our students and our research team.
Absolutely.
Yeah.
Absolutely. And I don't know how others feel about the cancel culture, but it's been challenging on social media to see someone make a mistake or a slip of the tongue and all of a sudden we're canceling them. They don't exist to us anymore, right? Now trust, there are some exceptions. There are some people who I think some might argue deserve to be canceled, right? But I think there are others who truly have just been misinformed, come from a background or a culture where some of the inappropriate phrasing and comments they make have been accepted. They come out into the real world and we're not having it. But I think there has to be an openness for how do we want to engage people who really truly want to be better and do better. Seeing some nods around the Zoom room. Thank you, Cassie. I appreciate that. Thank you for that nod.
And Daphne, we have a couple of questions in the chat here. First one is, what are some great ways to engage BIPOC in racial equity work so it is not only the white perspective without tokenizing or placing burden on BIPOC?
Yeah, well, if you read the literature about ways to do this, what's usually first and foremost is recruiting and retaining Black, Indigenous people of color. Is recruiting and retaining them, and how you retain them oftentimes is to provide incentives, to provide resources. Some resources that I've read just simply say pay people. If you're using their ideas, if you're engaging them, incentivize the experience, right? It's really about that. And so that's what a lot of the literature says. I would tack on a couple more things. I would tack on this idea about before you go out and make and sort of a knee-jerk decision around who to bring in, do a little bit of self-reflection and asking yourself, what is it that you feel like you need from that person, from these people who will be involved in the work, who may have different identities as yourself? Asking yourself, how do you want to engage with these people, with the people who are going to be helping you, who may be people of color or may have just different backgrounds or identities, and then recruit them and have transparent conversations about what you want and what you hope to learn from them, okay? And by all means, please provide resources, right? Sometimes it could mean writing into our grants, community liaisons, actually writing a line item, a budget line for these people. But resources are so, so important because communities of color have been exploited for so long in this work.
We have a couple more questions. Start off with this one. First, thank you for an excellent presentation, and wondering if you could speak more on the benefits and value of leading with qualitative work when building community engaged and community-based research partnerships.
Yes, so for people who do not know my background, I am a mixed methods researcher in that I use both qualitative and quantitative research equally in my work. And so particularly with communities of color, I have found it incredibly beneficial to lead with qualitative research, mainly because it provides an opportunity for me to learn their stories and for me to learn what their experiences are like. Also, with some of the work that I do, there is not a lot of previous science in the topic area. And so what the qualitative research allows me to do is it allows me to hear their voices. It allows me to actually hear from the people directly about the concepts that are important to them, also how they describe it, right? Because sometimes our academic jargon, our clinical terms are so far off from the way these people are experiencing problems. One of my early publications was, what does mental health mean to young Black men? What does depression mean to young Black men? And that publication came about because I sat in front of a room full of young Black men and I said, what does psychological distress mean to you? What does depression and anxiety mean to you? And they said, what are you talking about? We don't know what that means. We don't use those terms. So we had to really break down, okay, when you think about emotional health and mental health and well-being, how do you feel? What are the words that you use? And trust me, they were so far from the DSM that you wouldn't believe it. And so I think, I mean, this is my personal opinion, but I think if you're working with people of color and if you're working in an area that doesn't have a robust literature with the topic or on the topic, as much as you can elevate the voices of the people, not just what they say, but how they say it, I think you'll have a much more fruitful experience sort of leading or going down that path to unpack what the problems are and what solutions can be used to solve some of those problems. So I'm a huge advocate for some preliminary work, some early work that is qualitative to help contextualize the rest of your research program.
All right, and last question. Could you discuss some resources for building research teams that are diverse?
Yes, so definitely that slide, and Pat, I'm sure folks will be able to access the slides. Is that correct? Okay.
Sure, yeah.
So that's why I actually placed those. So those are all of those front covers of those reports are accessible, are free. You may have to contact me for that Kellogg report though, because it's a commission report by Kellogg and there's some protections and guidelines around that, but I'd be happy to share internally what we did with that report. But in terms of strategies, is that what people were asking, Pat? Like what?
Yeah, resources, strategies for building diverse research teams.
You know, so one of the things that I found helpful is talking with other health equity research leaders about what they're doing and what are best practices and what's working well with them. That has been incredibly helpful for me. Also realizing that, you know, and acknowledging the things that you don't know and what you hope to, you know, learn and who you hope to recruit to your team to help complement some of your skills is really important. Also, I was just talking to a super duper senior colleague at Michigan the other day about this, realizing that you are going to make some mistakes, right? Because of our own biases. And we bring people into our research teams, be they undergraduate students or master students, or even, you know, full professors who can help with the work. And we still see the world through our own lenses. And so I think just having some grace, you know, and some patience with yourself as you work through what does it look like to work with diverse teams is probably my #1 recommendation. But get some advice from people, have people help you craft a job description, have colleagues and people with more experience than yourself sit in on the screening interviews, for example, help you sort of look through and get a sense from people what their key values are and what they can bring to the work, or just a couple of other strategies that might be helpful.
Thank you for that. Yeah, and I think sometimes we can feel constrained by just our departments or our schools, and
Definitely.
sometimes we have to look outside of those to build diversity.
And know your strengths and know your weaknesses. Know what you're not good at. I mean, there's some things I'm just not good at. I ask colleagues, can you sit in on this screening interview? I'm not going to be able to pick up on this thing. So work together.
So I want to thank you so much, Dr. Watkins, Daphne, and I have to chime in as one of the MCD. This session has been hosted by the Michigan Center for Michigan UNC Center, and we're very excited that Daphne and Dr. Watkins will be joining, is joining in a leadership position. We're hoping for this next phase. So I just noticed that there's a lot of people here that I don't think are affiliates of the center. And so if you're at UNC, if you're at Michigan, and you're not currently an affiliate of the UNC MCDTR, please email me and any of us, Michelle Heisner, or get in touch, because we would love for you to join. We're really hoping to center anti-racism and health equity in all its forms in all of the work we do, and with a big focus on supporting junior trainees and a lot of the issues that we spoke about today. So if you're not currently a member, all you have to do, basically all you have to do is tell us you want to be a member. That's the requirement. And we'll send it out to you. So please, if you're not already a member, please join. So thank you so much for this really incredible talk. I'll turn it to Ed and Pat to close it out.
Thank you. Thank you, Daphne. That was terrific, really stimulating. I think we all got at least 3 or 4 of your 10 takeaways to ponder. That's a pretty good average for these things. And I really appreciate the thought that you put into this, and the breadth of your perspectives that you brought to it. It really made it very illuminating. Thank you very much.